Hello friends, most of the students keep the newer drugs and these drugs are often asked in INI-CET exam, and if you remember these drugs then you can really boost your rank. Before starting the session, if you have not seen the part 1, 2 and 3 about the new drugs for INI-CET exam, then watch it, and the link for this part 1, 2, 3 is in the description. And if you are coming to this channel for the first time, then subscribe my channel and follow for more pharmacology related updates. Let us begin these high yield drugs in today's session. Cardiovascular system anti-anginal drugs. Nicorandil. It is a nitric oxide donor drug. So it is a potassium channel opener. Remember, Nico starts from N. So it is a nitric oxide donor and it causes vasodilatation and decreases the preload and afterload. Remember, it is a potassium channel opener and it is not a blocker. So this type of the silly mistake you must avoid in the exam to score better. Another drug is ranolazine, which inhibits the late sodium influx. Now in its spelling, if you can see, so NOLA means late sodium channel is inhibited. So this decreases the intracellular calcium and decreases the cardiac work. Now another important drug is trimetazidine. This is a fatty acid oxidation inhibitor, PFOX inhibitor, and it shifts metabolism to glycolysis. So this metabolism requires less oxygen and less ATP. So this is a metabolic modulator. In its spelling you can see meta, that is how you can remember shift of metabolism from fatty acid to the glucose oxidation, which requires less oxygen and less ATP. Another drug is ivabradine, which is a funny channel blocker, and this decreases the heart rate. So this you can remember, it starts from the I. So IF type of the funny channel is blocked. In its spelling you can see bread. So bread means bradycardia. So it decreases the heart rate, and bradycardia is caused by beta blocker. So patients who cannot tolerate the beta blocker, in those patients you can give ivabradine. Now coming to the another drug, omecamtiv mecarbil. It is a myosin activator. So omecamtiv, M is for myosin, and AC, here you can see AC in its spelling, that is activator. So it is a myosin activator and this is used for heart failure with the reduced ejection fraction. So these drug increases the contractility without affecting the calcium level. Now another drug for heart failure is sacubitril plus valsartan, which is also known as ARNI. So sacubitril is a neprilysin inhibitor, so that will increase the natriuretic peptides and this will result in vasodilatation, natriuresis, promotes diuresis and decreases the fluid overload. And valsartan, we all know that it is a angiotensin receptor blocker. So valsartan will prevent the pathological remodeling and this drug decreases the mortality in the heart failure patients. Now coming to the endocrine drugs. So these include tirzepatide. So this drug is a dual incretin agonist. Remember, it acts on both the GLP-1 and GIP receptor and increases the insulin release. So these drugs can be used in those patients who are obese and diabetic, and this is the recently also approved for the obstructive sleep apnea, OSA. So this is also very important drug and you have to remember this drug. Another drug is a saroglitazar. So this is a PPAR alpha plus PPAR gamma agonist. So saro means Sara PPAR alpha as well as gamma. Now alpha cells are for the fat cells or adipose tissue. So these drug can be used for the non-alcoholic fatty liver disease. Then also in the diabetic dyslipidemia, hypertriglyceridemia, these are the uses of saroglitazar. So these way you can easily remember the drug. So these were the easy memory trick and tips to remember the newer drugs. If you like my video, then subscribe the channel and watch the next part about the new drug update. Thank you.